Medanta started, I just want to share with you the philosophy and the ethos of Medanta so that you can understand this journey the way it is reached today and what we hope to achieve in the future. So it started with my story of I was in the United States. I trained there at New York University in New York for cardiac surgery. And when I finished my training, New York University asked me to stay on the faculty. So I was teaching and I was practicing cardiac surgery in New York. Soon after I finished my training, very large number of patients from India started coming to New York for me to operate on them because those services were not available in India at that time. And it was very clear that if we wanted to serve the people in our country, because for everyone that could make it to New York, there were thousands who couldn't because they couldn't afford to come. So that's when the journey started of building Escorts Hearts Institute to bring not only just myself to operate on patients, but to bring the full ecosystem of a cardiac institute to India. And I returned in 1987-88, and we built Escorts Heart Institute from 88 onwards into one of the largest heart institutes in the world, and trained hundreds of cardiologists, surgeons, and everybody. So it was very successful, the transition. But one thing was very clear in our journey, and it became clear to me in 2003, 2004, that although we had reached excellence in cardiac care, the rest of the specialties, when they were needed for a care of a patient who was suffering from heart disease, those services were still of a very low level, so that medicine had not progressed in some of the other specialties. Looking back, it was clear to me that there are institutions like Mayo Clinic, Cleveland Clinic, Harvard, John Hopkins. These are some of the institutions of the world, mainly in US, who not only provide the best care, but across all specialties on the same platform. And then the fact that they have actually been the leaders for 100 years plus also showed that that model works. So I thought that we need to bring those institutions that I just named to India and make it the Mayos or the Clevelands of the East. That's how the journey of Medanta started. So in the planning, we got a 43-acre campus in Gurgaon. We had 4 Canadian architects design 2.7 million square feet of the infrastructure in Gurgaon to accommodate 1,300 beds. And in that, we incorporated some very special features. They were mainly aimed to do 3 things. One was patient safety, that the patient would get the best result that there was in anywhere in the world. Second, the doctors, to facilitate the doctors to be able to treat their patients at the highest order very efficiently. And third, the provision was made in the infrastructure for the lowest infection rate that anywhere in the world, because we put in air handling systems which were rotating air 2-3 times a minute, and also the fact that they were individualized so that air from one ward or one room or one operating room would not go into the other. It was all circulating through different or individual air handling units. So these are some of the features that we put in. Then came the technology. We went around the world and got the cutting-edge technology so that we could be giving the tools for the creation of that high end of medicine. Some of the new things that we introduced also was the concept of a hybrid operating room, where we put a robotic cath lab into the operating room so that combined procedures could be done under sterile conditions between the cardiologists and the surgeons and any other specialty that was needed to treat a patient seamlessly in one operating room. We also introduced brain suites. Brain suite is where the MRI is in the operating room, so that the neurosurgeon, who traditionally would have to make the brain operation to check whether the surgery was complete or not, would have to close the patient, reverse anesthesia, send them to MRI in the radiology department, and then if it was, and it is about 15-20% of the time that they have to go back to complete the operation, that it was a very unhealthy, unsterile way of doing things. So we put the MRI in the operating room, so the operating table real time slides into the MRI. The surgeon can see exactly what's going on, because these are delicate structures, and that they complete the operation and close, so the end result becomes much more superior. So there were many, many things which were incorporated into, and we started with a faculty who was benchmarked, so the human capital, the leaders were benchmarked against the best in the world. So no matter what specialty there should be international standard, not local standard only. And they would also be builders in the future of departments, teaching other people, building research. So all these attributes they had to have, and we fortunately got all of them before we started, and we started at the end of 2009, 2010. It was for the first time that this concept had ever been created in the private space. So we also had anxiety to say whether this concept would be appreciated by the public and will it succeed. But fortunately, it was embraced by the patients and the medical fraternity very quickly, so that we actually broke even in the first 15 months and also paid back our loans, and that gave us the confidence that this system of providing the highest end of healthcare to people across all specialties by a faculty and medical staff, which was working on the same platform, was possible, and that it would succeed financially also. So our systems became quite robust. We paid back our loans within the first 6 years, although the term of the loan was 12 years. And we also had the confidence now that we can take this standard to other cities, other areas where it was desperately needed. So the first step was building Lucknow, 1,000 beds, 200 million people in UP without any health care. In the meantime, we picked up 2 hospitals on the side, and our CEO will give you a more description of that. But then once we started building Lucknow, the next logical step was Patna, which is 130 million people in Bihar with no health care. And these people would have to travel long distance, and we still get a large number of people from Bihar and UP to come to Gurgaon. But Lucknow opened in January of 20, when just COVID was starting. And then Patna has started now a few months ago. And Lucknow has shown a very, very good performance, which you'll get the details. And so has Patna. So we have transported this standard which we were able to achieve in Gurugram, and then transplanted it into our subsequent facilities. And then now we have started construction in Noida, which is another huge area, crores worth, I think maybe over 1 crore of population just extending from there.
If you like the video, do like, comment, share and subscribe.